All right, time now for the Health Watch. As always, joined by Dr. Syed Hussain of Trinity Health of New England to talk about the topics that a lot of people are talking about out there on social media. Good to see you, Doctor.
Likewise.
I know a lot of the stuff that we talk about sometimes is just sort of combating misinformation and trends that are going online. Here's a term that I had never heard of until this morning, Teflon Flu. Apparently, some people worried about nonstick coatings on their cookware. What is, obviously, it's not the flu itself. I never like when we misappropriate the word flu, but what is it?
Yeah, there's a chemical, Tim, that is called PTFE, polytetrafluoroethylene. It's quite a mouthful. Okay. Also known as Teflon,
right,
which is used for nonstick cookware, especially nonstick pans, and it's very commonly used. So what happens is if you're cooking something, especially if you're on high heat, no oil or less oil, and there are fumes that emanate from that pan, that can lead to a constellation of symptoms that is called Teflon flu, which basically could be fever, headaches, body aches, dry cough. And so if you're experiencing any of those, then there are a couple things that you can do. First of all, if you have a vent hood, use that.
Right.
Use it all the way 20 minutes after you're done cooking, so there's recirculation of air.
Okay.
If you don't have that, then crack a window and keep that window open so there's air that can circulate and remove these fumes, potentially harmful fumes. And then also consider using something else besides a Teflon pan. So there are things that folks can do. I'm not a chef, but experts say cast iron, for instance, pans.
Yeah, cast iron
with
you don't
proper
really have to worry
seasoning
about it.
are good and will be useful as well.
Just curious, is this something that happens acutely after only one use, or is it something that you have to do multiple times and it builds up over time?
It all depends on how you use the pan, and if there's if you're using it at high heat and if there are fumes that are emanating, for instance, then that can lead to it.
Yeah. Don't mind cast iron, though. It seems a little counterintuitive that a lot of times you don't have to do much to clean it. You can just wipe it off, like you said, so long as it's got that proper seasoning, as they call it, of the oil that has sort of baked in and polymerized. It's definitely not a bad option.
Yeah, so something to consider, something to keep in mind.
Yes, absolutely. Okay, on to TikTok. Here we go with TikTok again. You know I'm not necessarily a fan, but there's all sorts of health trends, and there's a new obsession online that I guess people are calling dealing with cortisol, like Cortisol Face, or I know cortisol is a stress hormone, so there might be something here with that.
Yeah, so let me tell you, so it's one of, like you mentioned, another TikTok fad. Unfortunately, there's not a lot of evidence behind this, Tim. Cortisol face, basically what they're referring to is swelling or puffiness of the face. Now, this is a condition that can be part of Cushing syndrome, for instance, a very rare disease that is characterized by high cortisol. And cortisol indeed is released in stress, but the body has enough feedback mechanisms where it can control your hormonal levels. So normally, even if you're stressed, it won't lead to puffiness and swelling of your face. So I want to make sure viewers understand that. And if you do have symptoms suggestive of that, then talk to your healthcare provider. There are other things you can consider. Is your diet okay? Are you, do you need to reduce salt intake because salt can cause water retention? Is your sleep okay? Do you have any medical conditions that may be leading to this? Hypothyroidism, which is low thyroid hormone, for instance. Or are you taking any medications such as steroids, which can lead to something like this? So there are a lot of other conditions that need to be considered, but suffice to say, just stress will not cause facial swelling.
Okay. It sounds like maybe indirectly, though, just because stress can cause a lack of sleep, and then maybe lack of sleep can, in turn, cause that puffiness.
Yeah, I mean, there are other things to consider before we say, okay, it's just stress, and these are the things that you need to do as a result.
Can I just say that as somebody who's approaching 50, I don't mind having a slightly puffier face because it just means there's fewer wrinkles. I need to lose
comments on that, Tim.
I need to lose 25 pounds, but if I do, I'm going to look about 5 years older, and I'm not looking forward to that, Doctor. All right, thank you so much. So we've learned about Teflon Flu. We've learned about Cortisol Face. I'm learning right along with you guys. Doctor, thank you so much.
Thank you.